As a working lawyer, judge and ombudsman, I have had a number of opportunities to remain involved with many contemporary medico-legal issues. One such and most recent example is the 16 months I spent chairing, at the government's request, the confidential forum for former inpatients of psychiatric hospitals. This in 2005 was a legal first for New Zealand, which sought to add a truth and reconciliation element to dealing with issues that some former patients wished to raise affecting their time in a psychiatric hospital. The forum's work was subsequently completed by my colleague Judge Patrick Marnie when I was appointed Governor-General, and it released its report 2 years ago in 2007. Those connections with health, disability and well-being have widened further since the appointment as Governor-General in August 2006. The Governor-General role means being, with my wife Susan, patron of about 150 organisations, many of which have an interest in health. They include organisations as diverse as the Arthritis Foundation, the New Zealand AIDS Foundation, and the New Zealand Organisation for Rare Disorders. I'm also speaking today as a former patient. After a road accident sustained by Susan and I in July 2002, and an odontoid fracture of C2, that's the one that makes you turn, I spent 3 months in the derrick around the head environment of halo traction equipment. These three perspectives, family, professional and patient, have provided me with an appreciation for the work undertaken by those working in the health sector. I acknowledge the hard work and commitment that health professionals display in their work. Having thus hopefully established a place to stand, I would now like to address the theme of your gathering. My whai kōrero is about the importance of holistic health and well-being in difficult times. There are several signposts available in examining this issue. The first signpost is dated more than 20 years ago, when the first international conference on health promotion, held under the auspices of the WHO, the World Health Organization, happened in 1986. Named after the city in which the conference was held, the Ottawa Charter, as will be well known to many of this audience, continues to guide the work of health promoters to the present day. The Charter, while recognising that peace, shelter, education, food, income, sustainable resources and social justice were the fundamental conditions for health, went further by emphasising that these had to be achieved within a wider framework. For example, whilst food is important, too much or the wrong kind can just as easily lead to many problems as not having sufficient. The Ottawa Charter outlined 5 areas for action: building healthy public policy, creating supportive environments, strengthening community action, developing personal skills, and reorienting healthcare services towards prevention of illness and promotion of health. A second signpost, 20 years after the Ottawa Charter, occurred last year in 2008. The Ottawa Charter's framework has been energised by the release of a final report of the Commission on Social Determinants of Health, also established under the auspices of the WHO. That commission, chaired by a leading professor of public health at University College London, has won international praise for its forthright approach by coming to view health as a human right. Not a document to mince words, the Commission said reducing health inequities was an ethical imperative. As it noted, and I quote its words, "Social justice is a matter of life and death. It affects the way people live, their consequent chance of illness, and their risk of premature death. We watch in wonder as life expectancy and good health continue to increase in parts of the world, and in alarm as they fail to improve in others. Differences of this magnitude within and between countries simply should never happen." But where the Commission's report differed from so many others was that it outlined key recommendations for tackling differences between nations and within countries. It is often said that good health promotion is about ensuring healthy communities, symbolically represented by the fence at the top of the cliff rather than the ambulance at the bottom. The Commission, the 2008 Commission, the second signpost, went much further by effectively questioning why the cliff should exist in the first place. It called for a new approach to development that saw health as the goal of all social policies rather than merely a welcome byproduct. And most strikingly, it challenged the nations, communities, and the international community to close the health gap in a generation. These two signposts to which I have made reference are international in character, and one might think, what does this mean for New Zealand? There are, I think, several points to make that are relevant for our country. First, from what I have read, we are familiar with many of these issues, and New Zealanders continue to face serious challenges to our health. For example, the media continues to run stories of increasing rates of preventable diseases such as diabetes and HIV/AIDS. Also, 45 years after the first American Surgeon General's report on the dangers of tobacco use, 1 in 5 New Zealand adults continues to smoke. Secondly, however, on the positive side of the ledger, the life expectancy of all New Zealanders continues to increase. There continue to be significant differences, though, between the average lifespan of Māori and Pacific New Zealanders and the rest of the population. Thirdly, with increasing life expectancy come other inevitable health issues that we all face in the latter part of our lives, and the increasing demands that places on the health system. And finally, we are now faced with an economic crisis. History shows the stress and tension caused by the economic downturns often have a negative effect on the well-being of individuals, families, and communities. This all paints a somewhat grim picture, but it does not have to be unremitting gloom. I believe in New Zealand that we have several models that show the connections between health and other social indicators. In keeping with the spirit of the Ottawa Charter, many successful initiatives have come from community responses to community needs. The first model is that provided by Plunket. One of the biggest providers of well-child tamariki ora checks are by Plunket nurses.